Eyewitness News presents Newsmakers with your hosts, Jayne Bugda and Andy Mehalshick.
Hello and welcome to Newsmakers. I'm Andy Mehalshick.
And I'm Jayne Bugda. Suicide awareness and prevention is the topic of discussion today. Starting the conversation about suicide can be difficult. Our guests hope to change that through awareness and understanding.
And Jayne will focus on the mission of the Susquehanna County Suicide Awareness Initiative. Our message and information is for anybody who is struggling and needs to talk. We'll introduce you to our guests coming up.
And our conversation will begin when this edition of Newsmakers returns right after this. Welcome back to Newsmakers. I'm Jayne Bugda along with Andy Mehalshick. And sadly, cases of suicide across the nation and here at home are on the rise, Andy.
And Jayne, all too many times over the years we've seen that it happens in a family or a neighborhood, and the question is, why didn't I know about that? How could it possibly happen to that individual and our family? So that's what we're talking about today as well.
Right, and our guests are here to bring some understanding and awareness to suicide in our area. And we are talking today with our guest. We are joined by Judy Herschel. She is a Susquehanna County Commissioner. Also joining us is Maryann Colbert. She is the administrator for Lackawanna-Susquehanna County's Behavioral Health, Intellectual Disabilities, and Early Intervention Program, and Denise Carey, who is with the Scranton Counseling Center. Judy and Maryann, we welcome you to Newsmakers, and Denise is a friend of Newsmakers. She's been on with us many times before. So welcome to the program.
Welcome.
And we hope today to shed some light on the topic. And while we're focusing on the Susquehanna County Initiative, we are going to have information that's available for everyone, and we'll have the national number up for anyone who needs to talk. Our first question, of course, is what is the Susquehanna County Suicide Awareness Initiative?
If I can answer that question, and thank you once again for having us on today to discuss this extremely important issue. Unfortunately, mental health issues have affected our communities for way too long. And over the last several years, and particularly this past year, with the issues that are resulting with COVID, that are affecting the mental health and behavioral health of our community members, we work very closely with one another because we are seeing some very devastating things. And several years ago, Maryann was part of this initiative when Susquehanna County saw a rise in suicides among our youth. And this group was formed during that period of time and has stayed pretty cohesive during from then, which was 2016 to the present. With COVID and all of the things that arose with that, our initiative took a little bit more of a broader focus. And we've been working very closely to bring awareness. We're very lucky in Susquehanna County and our surrounding areas to have very dedicated individuals that are working at the front lines. Maryann and Denise are two of them. I work very closely with them. Maryann is the administrator of the Lackawanna-Susquehanna Behavioral Health, Intellectual Disabilities, and Early Intervention Program. And what that is that's a program that started in 1967. And it was the result of them passing, the legislature passing the Intellectual Disabilities Act of 1966. And prior to that period of time, we all know that mental health issues, intellectual disabilities, and behavioral health was handled in an institutional type of setting. Since then, there has been more of a community focus on how we treat these issues. And we work very closely with the Lackawanna-Susquehanna Behavioral Health office to ensure that our area gets what they need. And they provide us a wide array of different services, one of which is the crisis services, which Denise works with Scranton Counseling to provide that. So we work very closely together, and we're here to talk about prevention, what intervention can be done, what supports are available, and to most importantly, reduce the stigma. So once again, thank you. And we're here to answer any questions that you have. Mm-hmm.
And that's a key word, Judy, stigma. And you know, I remember, at least in our generation growing up, no one talked about suicide. It was always somebody else's problem. It doesn't happen to me or my family or my friends. And is that still the case out there? Are people afraid to talk about it? Are families afraid to talk about suicide because they're afraid it'll happen if they talk about it, if they open the door?
Unfortunately, if I may, yes, Andy, that's really true. Even in this day and age, 2021, we still have many persons out there who are struggling. And some people believe to this day that asking someone if they're, not feeling well, if they're in danger of hurting themselves, they're afraid that that might actually instill the idea of if someone's depressed, that they may go ahead and hurt themselves. But we know clearly that that is not true. You cannot instill suicidal thoughts in someone who doesn't already have them. But that is a big myth out there that continues.
And one thing we should keep in mind is that honestly, we're not here for, this is our job. This is a professional, obviously, thing that we're doing, but all of us have been affected in some degree by suicide in some way. We've lost loved ones, we've lost community members. And when it hits home like that, especially in a small community where everyone knows everyone, where it puts us in a situation where we have to talk about it. So we have a long way to go, but that's where everyone can help with that, because it can affect anyone. And we have to reduce these misconceptions and these stigmas.
And when we talk about, oh, I'm sorry, go right ahead.
Oh, I was going to say that it's important for us to recognize that mental health and physical health are equal, and that, taking care of our mental health is as important as taking care of our physical health. And the way that we reduce that stigma is to encourage individuals to think about their mental wellness and to treat their mental health and their mental wellness the same way that they would treat a physical health condition that they might have, and seek help for that.
And when you mention somebody's out there that may be struggling with thoughts of suicide, how do we make it easier for them to take the first step and reach out to someone and make a call?
Well, there are many helplines and hotlines and warm lines that are available for individuals who are struggling. So anyone can contact the Scranton Counseling Center, which is the 24-hour day, 7-day a week, 365-day a year crisis provider for Lackawanna and Susquehanna counties. And they can contact the Scranton Counseling Center at 570-348-6100, and in Susquehanna County at 570-278-6822. But if they're really struggling and they don't know those numbers, they can call the National Suicide Prevention Lifeline at 1-800-273-TALK. They can call 911 if they're really in danger of harming themselves. They can call 211 if they need information on how to access counseling. So we need to promote through programs like this and through all of the community stakeholders that we work with every day. We just need to keep reinforcing that asking for help is not a sign of weakness, it's a sign of strength. And it's taking the first step to help yourself when you're not feeling mentally well.
And what would you say, what would you say to family members or friends who are concerned? Are there warning signs? Are there things people will say? Because we've often heard this, and is it a myth that if somebody says, I'm going to hurt myself, the old tales were, well, if they're talking about it, they're not going to do it. Is that true?
Absolutely not true. The warning signs, there are several that are out there, and I think the most important thing is that we all learn what the warning signs are so we could all be available to help someone. Definitely, if there are talkers and there are doers, and both do hurt themselves. Someone who feels like a burden, and a lot of times the person who's not feeling well and is really struggling will give out clues if we just listen and let them speak, and don't be judgmental or don't rush to hurry up and do something. Let them speak and let them listen. You will get a pretty clear picture of what's happening. If they're isolating, if you saw them a lot, they're on the bowling team and then they don't come for a while and then they just stop coming altogether. This could be a sign something's happening. Someone with increased anxiety, and 1 in 3 persons now are showing up with anxiety disorders since the pandemic. So anxiety is off the charts at this point for everyone. It's really having a hard time struggling with that. And increased anxiety is a big warning sign as well. someone who's saying that they feel trapped or they're white knuckling, see no way out, looking for ways to hurt themselves, go and buy a gun, gathering pills, collecting pills to take in an overdose, gathering knives, putting a noose together. Any of those things are certainly very, very big warning signs. Increased rage or anger. Someone who typically is not that way, especially if you see that big difference in their mental health and their displaying of behavior, that's a warning sign. Someone who's having mood swings that are going from really, really crying or angry or sad, expressing hopelessness, which the one as a counselor worries me the most is someone who's voicing hopelessness. They really feel like there's nothing that's going to help. So we have to really try very hard to instill hope, even in that one little moment that we have to get them help. But hopelessness is really a tough one. Sleep problems, either sleep too much, not enough. Of course, talking about suicide, like you said, talking and doing, both talkers and non-talkers, can hurt themselves. And anyone who has any kind of plan, if you hear them say, I'll be gone by next year, I'll be gone by tomorrow, I'll be gone 6 o'clock tomorrow, I'm going to the store and I'm getting a gun, any kind of plans to everything has to be taken very seriously.
So it's not, for someone out there to actually say something to someone, you shouldn't be afraid to say, are you having trouble? Because I think a lot of times we figure that we kind of shy away from that as loved ones, as family members, as a friend. So it's okay to say to someone, you need to talk, and then, encourage them to reach out.
Ask them if they're okay.
Absolutely. It's important to keep in mind that when we're going through something like that and we're struggling with our mental health, it's very hard to ask for help. It's very hard. So we have to look upon ourselves to see what we can do as elected officials, what we can do as providers, what we can do as individuals with a platform. And what that entails is asking the questions, asking if it's okay. We for so long have not done that within our culture, and it's okay. In fact, we encourage that. Denise brought that up. If someone is around for a while or you've not heard from them, are you okay, goes a long way. And asking that question, are you considering? And it's okay to have that conversation. There are a lot of programs out there for individuals at every level, from the prevention side to the intervention side to what's needed after intervention. I think the great thing about our culture discussing this now and putting it on the forefront is that we are now beginning to get the services that we so desperately need. With Lackawanna-Susquehanna Behavioral Health, we have drop-in centers, we have crisis, we have providers within our correctional facility, we have prevention programs within our schools. We work with 48 different providers in the area that provide services. Case management. So the services are there. We need to continue to spread the word. It can't, even though this is Suicide Awareness Month, we need to be doing this every month and make sure that everyone knows that these services are there when they're ready to accept the help.
And asking, how can I help? And not leaving people alone if we really believe that they're at risk, and staying with them until they're connected to a crisis service, to a hospital, to someone who can do an intervention.
And we've seen this, I've seen it in my own personal life and dealings over the years, and from covering stories about suicide or involving suicide. Could a person be predisposed to suicide? I hate to use the word runs in the family, but if it's happened in the family, maybe a cousin or a family member, maybe not even in the household, could it be some kind of a genetic type situation? Or we use the word learned, but if they've seen it in the family, could that lead someone who might have some issues later in life to saying, well, if so-and-so did it, I can do it also, or that's the way out? It's hard to talk about it. You guys are pros, we're not, but we
know that people are more at risk if they have a family member who has died by suicide. And I know, Denise, you have a lot of experience with this.
For sure. As a matter of fact, I tell those that I work with, if you do hurt yourself, a parent, someone with a parent who died by suicide is a very high risk for suicide, to die by suicide as well. Also, I tell them, suicide does not end depression. It just passes it along to family. And that's true. The rest of their lives, the family members, those left behind, struggle the rest of their lives with feeling guilt, feeling pain, feeling confused, never getting answers that they wanted. Why? Those questions are never answered. But the high risk for suicide in families, and also depression and bipolar disorder, schizophrenia, they all have a genetic link. So you could be genetically predisposed to a mental health concern, sure.
And we're talking about the Susquehanna County initiative. In Susquehanna County, typically a rural area, and are you seeing a rise in the rural areas? And not to say that it's not, it wouldn't happen there, but is there a concern for a rise there? And is that why this initiative is so important?
One of the difficulties is it's very hard to get any type of local or statewide or federal statistics. So we do have current statistics with our area, and through our experience, we are seeing that there has been a rise. There's been a rise in mental health issues. There's been a rise in suicides. We are finding a trend. Like I said, it's not scientific. It's just based on what we're seeing, that certain age groups are being affected, which Maryann and Denise can speak to. But yes, we are seeing an increase in mental health and in suicides and in overdoses of opioids also.
We know that individuals 18 to 24 are very much at risk right now related to the pandemic and increases in anxiety and depression. Older adults over age 65 are more isolated and more at risk. But I think in Susquehanna County, we're seeing a rise in males ages 35 and older who are dying by more lethal means, and access to lethal means is available because we have a rural community where there are many hunters and there's more access to weapons, and we know that men die more frequently using lethal means.
And the other thing I want to bring up too now, I know we've been showing also the number for military. And are you seeing an increase in calls for help from our military members?
Just this past 2 weeks with the issues in Afghanistan, 39,000 military servicemen and women have called the crisis line just in the past 2 weeks. So we definitely have seen an increase in mental health issues as well.
And when you deal with, and I know, Denise, in the past you have dealt with military issues, is it a different way of talking to someone in the military than it would be someone, I think when you think of somebody in the military, they have seen a lot in their service. Is there a different way to approach somebody in the military who you think might be having problems, or is it the same open conversation?
Well, it's in a little different in that, though. I think Maryann, when she said it perfectly, it takes courage to talk about it. It's the strength. We used to say the strength of the warrior asks for help, and that really is true, because it is hard. It is hard to talk about it. We have to all recognize that depression and bipolar disorder happens in civilian and military life, and that it is not a character flaw. It is not a weakness. It is not anything that they caused or have some type of fault for. And so educating both military and civilian about what really it is when someone is struggling with depression, PTSD, bipolar disorder, all those things happen in the military as well as happen in the civilian world. And unfortunately, we do know that there's a rise in those disorders. And now anxiety disorders, like I said, have 1 in 3 persons have now they're showing signs of having a significant anxiety disorder since the pandemic started. But in the military, the good thing is that there are a lot of groups out there, even, in the community, veterans groups who help spread the word and help the military and veterans know that help is there, and it's not it's not a character flaw. It's not a weakness to go. And they really do. They have that brotherhood. They still help each other, and they help them get to treatment. So it's a good thing.
Well, we are going to take a quick break, and when we come back, we are going to continue our conversation on suicide awareness and understanding. We have information, resource page on pahomepage.com, and you can find information on our show on pahomepage.com under our Newsmakers link. And you are watching Newsmakers. We are a proud recipient of 3 Pennsylvania Association of Broadcasting Awards for Excellence in Public Affairs Programming, and recently a Keystone State Media Award for Excellence in Talk Shows. We'll be right back after this.
And welcome back to Eyewitness Newsmakers. Andy Mehalshick along with Jayne and Bugda, our producer. We are talking suicide today, the warning signs and special programs in Susquehanna County. Our guests are Judy Herschel, Susquehanna County Commissioner, Maryann Colbert, the administrator for the Lackawanna-Susquehanna County's Behavioral Health Intellectual Disabilities Early Intervention Program, and Denise Carey from the Scranton Counseling Center. Ladies, thank you for joining us again here today, talking about a topic that, quite frankly, many people are have a hard time talking about, and it's been like that seems like for ages and ages. Let's talk about the Susquehanna County Suicide Awareness Initiative. What are some of the programs in that initiative?
It's Suicide Awareness Month this month, and we set out to do as much as we could during this particular month to spread awareness. We have we have arranged for mental health first aid to be to take place. There are classes. Maryann can speak to that for anyone that is interested in doing that. We encourage frontline workers, individuals that work with youth. We're doing a separate track for youth and adult for that. We have billboards all over Susquehanna County. Maryann, what else have we done?
We're also doing a youth mental health first aid training. We are doing a family and friends training and talking about in our own voice. And some of these trainings are being presented by our local NAMI affiliate, the National Alliance on Mental Illness. They have been our partner for Suicide Prevention and Awareness Month, along with Scranton Counseling Center, the County Commissioners, the Advocacy Alliance, and they are doing a lot of education, talking about in our own voice, people with mental illness, talking about their experience, and sometimes having the ability to hear someone who has mental illness talk about their experience makes it easier for others to open up about their experience. And then also hearing from loss survivors. So individuals who have lost someone to suicide can oftentimes make a profound impact, and hearing about their loss and how it has impacted their life. Denise talked a little bit about this earlier, about the people who are surviving that loss and how it impacts them. That also can make an impact on individuals who are thinking about taking their life, and really dissuade them, I think, from doing that.
We're fortunate to have had grassroots groups form within our community also. We also assist them. We just had a program about a week ago in Montrose called Stop the Stigma. That was on mental health, and we had speakers at that. As much as we can get involved in the community, because as Denise had mentioned, it's a multifaceted thing. It's not an easy fix. You need the support groups, you need the prevention, you need the community involvement, you need all of those things for us to succeed at becoming as healthy as we can be. So we have to continue to do and continue to be creative, and that's what this group is. We have had initiatives where we wrote letters to individuals in senior apartments when they were feeling isolated. We worked with the schools to get that done. So we meet monthly. We developed a plan for that month for the near future, and we're going to continue to move forward into the future until this is not an issue anymore.
And I think it's important to know that you go on all year through. This isn't just a 1 month thing. You are all active all year through. So you have a very active Facebook page.
Yes. And we have individuals in the community going out to local gun shop owners, partnering with them to distribute gun locks. We are putting up magnets in restrooms all over the county in case individuals, are having thoughts of suicide, and just so that they have an opportunity to have access to the number. We are distributing information in the schools, at the county fairs, everywhere that we can, handing out lifeline numbers and trying to give people hope, encouraging help-seeking behavior, ending stigma, and giving people hope are three, I think, of the main goals of the Suicide Awareness Initiative.
And I do want to remind everyone, we have less than a minute left, that information on today's program is on pahomepage.com under the Newsmakers link, and we also have a resource page on pahomepage.com. And we're all wearing our suicide awareness pins, and we want everyone out there, Judy, Maryann, and Denise, we thank you for your work and for being champions out there for this cause. And we thank you for joining us today. Our time just flew. So we remind everybody, information on pahomepage.com. If you need help, you need to talk, reach out and talk to someone. For Andy Mehalshick and everyone behind the scenes, I'm Jayne Bugda. Thank you for making Newsmakers part of your day, and we'll talk again next time.